Safety Lesson 5 covers radiation exposure monitoring. The personnel dosimetry system that tracks your occupational dose throughout your career. Radiation is completely invisible. You cannot see it, smell it, hear it, or feel it at diagnostic levels. Without monitoring, you have no way to know how much dose you've accumulated. 10 minutes. Let's cover everything you need to know. Personnel monitoring serves 3 critical functions. Legal compliance. Federal regulations, specifically NRC regulations, and state radiation control programs require monitoring for any worker likely to receive more than 10% of their annual occupational dose limit. Dose tracking. A lifetime cumulative dose record is maintained for each worker. Workers have the legal right to request their dose records at any time. Records must be kept for the duration of employment plus 30 years. ARRT verification. Monitoring results confirm whether your radiation protection practices are actually working, or whether technique or behavior changes are needed. One critical fact: dosimeters are passive record-keeping devices. They do not protect you. They do not give real-time feedback except for the electronic pocket dosimeter. They only confirm what your exposure has already been. Film badge uses photographic film in a light, tight holder with filters to identify radiation type. Monthly lab readout, sensitive to heat, humidity, and physical damage. Now largely obsolete in U.S. clinical settings, replaced by TLD and OSL. TLD, thermoluminescent dosimeter. Lithium fluoride crystals store radiation energy in electron traps. Heated in the lab, crystals release stored energy as light, proportional to dose. Accurate, reusable, and insensitive to environmental conditions. Typically read quarterly. OSL, optically stimulated luminescence dosimeter. Aluminum oxide crystals stimulated by laser light. Most sensitive of the passive dosimeters. Can be reread multiple times to verify results, unlike TLD, which is consumed by the readout process. Current standard in most U.S. imaging departments. EPD, electronic pocket dosimeter. Real-time digital dose rate display with audible alarm at a user-set threshold. Used in addition to a primary badge, never as a replacement. Badge placement affects the accuracy of your dose record. In a single badge system, the badge is worn at collar level, outside the lead apron when applicable. This represents unshielded dose to the head, neck, thyroid, and lens of the eye. In a 2-badge system, used in fluoroscopy and interventional work, the collar badge is worn outside the apron at collar level, and the waist badge is worn under the apron at waist level. A ring badge is worn on the dominant hand index finger for extremity dose monitoring. A fetal badge is worn at waist level, under the apron, after a written pregnancy declaration. Key rules: never wear another person's badge. Never wear your badge during your own medical x-rays. Store the badge away from radiation sources when you're not working. Report a lost badge to the radiation safety officer immediately. Know these limits by heart. The ARRT tests them individually and in comparison. Occupational whole-body effective dose, 50 millisieverts, or 5 rem per year. Cumulative lifetime guideline, 10 millisieverts times your age. Lens of the eye, 150 millisieverts per year. Note, the ICRP has revised this downward to 20 millisieverts. Skin and extremities, 500 millisieverts per year. Declared pregnant worker, fetal dose, 5 millisieverts for the entire gestation. Monthly maximum, 0.5 millisieverts. General public, unrestricted areas, 1 millisievert per year. Students under 18, 1 millisievert per year. 1 conversion to no cold. 1 rem equals 10 millisieverts. The ARRT tests both unit systems. These are ceilings. ALARA requires staying well below them. A limit is not a target. Radiation areas are classified and posted based on dose rates. Radiation area, dose rate capable of delivering 5 millirem in any 1 hour at 30 centimeters from the source. Posted. Yellow and magenta radiation symbol, caution, radiation area. High radiation area, 100 millirem in any 1 hour at 30 centimeters. Posted. Caution. High radiation area. Lock and key required. Audible alarm if occupied. Entry requires authorization and dosimetry. Very high radiation area, more than 500 rem in any 1 hour at 1 meter. Grave danger posted. Physical barriers and automatic alarms. No routine occupational access. Unrestricted area, dose rate below 2 millirem in any 1 hour. No special posting required. General public access permitted. These classifications drive structural shielding design requirements for adjacent areas. 4 survey instruments. Know when each one is used. Geiger-Müller counter. Gas fill detector. Audible click for each ionizing event. Excellent for contamination surveys and detecting the presence of radiation. Not accurate at high dose rates, it saturates. Ionization chamber. Also called the cutie pie. Measures actual dose rate in roentgens per hour. Accurate across a wide dose range. Used for calibrating other instruments and conducting radiation protection surveys. Standard instrument for area surveys. Scintillation detector. Sodium iodide crystal emits light when struck by gamma radiation. Highly sensitive, used in nuclear medicine contamination surveys. Can identify specific isotopes by their energy spectrum. Proportional counter. Distinguishes between radiation types, alpha, beta, and gamma. Used in specialized health physics applications. Requires precise gas pressure maintenance. Survey instruments measure area dose rates. They do not replace personal dosimeters. Every licensed radiation-producing facility requires a Radiation Safety Officer, or RSO. The RSO is designated by the facility and responsible for implementing the entire radiation safety program. RSO responsibilities: investigating doses that exceed limits, reviewing dosimetry records and trends, authorizing radiation worker status and training, conducting area surveys, and being notified of pregnancy declarations, lost badges, equipment malfunctions, and radiation incidents. 8 required radiation safety program elements, written policies and procedures, a personnel dosimetry program, initial and annual refresher training, equipment inspection and calibration records, documented area survey results, incident investigation and corrective action records, dose records maintained per regulatory timeframe, duration of employment plus 30 years, and an annual program review. 3 monitoring questions. Think before the answer drops. The answer is B. Outside the lead apron at collar level. In a 2-badge monitoring system, the collar badge worn outside the apron at collar level represents dose to the unshielded head, neck, thyroid, and lens of the eye, where the lead apron provides no protection. The waist badge under the apron tracks shielded torso dose. In fluoroscopy, the collar badge routinely reads significantly higher. The answer is C. The OSL dosimeter. Optically stimulated luminescence uses aluminum oxide crystals stimulated by laser light. It is the most sensitive of the passive dosimeters, detects very low doses accurately, and can be re-read multiple times for result verification, unlike the TLD, which is consumed during the heating readout. OSL is the current standard in most U.S. diagnostic imaging departments. The answer is B. 50 millisieverts, 5 rem per year. This is the NCRP report, 116 Occupational Whole Body Annual Effective Dose Limit. The 5 millisieverts limit applies to the fetus of a declared pregnant worker. The 150 millisieverts limit is for the lens of the eye. The 500 millisieverts limit is for the skin and extremities. Know all 4. The ARRT tests them individually and comparatively. You covered why monitoring matters. All 4 dosimeter types, badge placement rules, NCRP dose limits, radiation area classifications, survey instruments, and the radiation safety program. These concepts show up throughout the safety category on the registry exam.